Hello, everyone. Good afternoon. Welcome. Dr.rao here. I found some time, so I thought I would come and chat with you. I was uh, busy this morning, but still I attended a couple of rooms in the Noom Vibe. Uh, and here I am. Found some time till 1 o'clock, so 30 to 45 minutes we can chat. So I thought I will come in front of you and see what's going on, or any questions, or anything I can answer, or just tell you what's going on with me. Okay. So I was doing the morning routine with whoever attended. Uh, I think something happened with the new vibe. I was muted by maybe different call coming in, whatever. I'm sorry about that. I noticed it at the end of the class. I hope to correct that next time. Okay. So, but I was doing the regular thing on the morning routine. I was on the video on the Instagram and also on the Facebook, YouTube, and LinkedIn via StreamYard, right? Only mishap happened was on the iPhone, which was doing the Noom Vibe. Hopefully, you can hear me and see me okay on all the different channels. I'm also on the Clubhouse today. I was not going there much these days, but I just put it on. Okay. There will always be replays if you want to catch up with any of those talks, whatever I do. Uh, Now, in the morning routine, basically, that is designed to really help people who are going through the burnout or stress, right? A lot of people are going through that in the modern working conditions where very little attention is given to our being, and very little attention is given how you feel about things, how you react to things, and how you should be nurtured. So if you depend on the workplace, it may be not possible for you to nurture yourself inwardly, having that inner resilience to go and face the kind of only very reductionist, materialistic culture where nobody cares really about the employees deeply, right? They use them as tools to generate revenue, and then they're left alone to do it. So, as a part of my proactive wellness philosophy, where we are proactive about our wellness by taking care of our body, by taking care of our mind, and by taking care of our heart, and also contributing to the life, to society, to family, to yourself, and all that. Okay, so you could be a very skilled worker if you can manage your mind. If you could be very uh, good worker if you can know how to nurture your body at the right time, right? I hope that makes some sense about what I'm saying. So instead of going out there and just taking all the treatment and reacting to that, you could really get all the tension out of your body by stretching or doing any exercise, walking or running or anything that you like to move the body, but at the same time keep the mind silent, right? Proactively, you are working on the body to be prepared for, suppose you are a sportsman, you can stretch those muscles that are needed to be working there, strengthen them. Why I chose yoga is yoga can be used to stretch, to relieve the tension, and to prepare yourself for any sport or activity, and attending to those muscles that you need when you really play the sport, right? And also you could build up your respiratory reserve, whereby you understood what is deep breathing, when can I do it, what can I really do to improve my respiratory efficiency. That will definitely boost your energy and also calms your mind. So that's another reason I chose yoga. And also, yoga can be customized to anybody. It could be a male or female, it could be young or old, it could be somebody who has some underlying diseases. We can customize if we know what's happening with them. So it's a kind of regular daily practice, not only to strengthen and really breathe in a lot of energy into our bodies, but also study them, study the body where it has developed certain bad habits, certain way of sleeping, and developing pain in your neck or the shoulder, and adjusting that, but also really taking that out early in the morning. Don't go out there with a neck sprain or shoulder sprain, where there are simple stretches you can do that will relieve half of the pain at least, and then you have to get the treatment or further, yoga therapy and all that. So it's very customizable, very uh, changeable, right? Adjustable to people's disease, people's age, people's gender, what system you are focusing. Also, we can focus. Suppose you have something like a abdominal problems, then we can teach you those asanas that you could do. Suppose you are a diabetic, we can teach you those asanas that will help your pancreas a little bit better. Okay, you cannot cure anything with this completely, but you can help support the healing process through any other means. You could be taking some ayurveda aushadas, or you could be taking homeopathy medicines, or you could be taking allopathy medication, which is what I do. So I kind of employ my judgment to really not keep people only on medications, but maybe control the medications a little bit, cut down the medication dosages a little bit, or take them off completely if they don't need them. You know, but for that you have to enhance your lifestyles, and yoga gives you a very good lifestyle of moving the body. And at any you can be doing in the bed, you can be doing on the floor, you can be doing standing up, or you can be standing behind the chairs. Number of ways you can do, and you don't need much space either. There was one video I did one time. It is about staying in our 2 feet and really not moving anything at all. I could do a lot of stretches. That was very fun. The entire 45 minutes, I was not moving from those 2 feet, where I really, uh, you know, uh, staying there. Okay, so it's a kind of understanding what kind of things we need for any activity, and then preparing for it. That is incorporated in the morning routine. If you send me any messages, or if you come on the room and I'm doing it, you could tell me what you would like to work on. It could be a backache, or it could be diabetic problem, it could be high blood pressure, or it could be knee pains, or anything like that. If you can tell me, then I could incorporate that for that particular need the next day. That's how I incorporate. Or better as if you want to really have a real focus and all that, you can go and join my wellness club, which happens in the morning around 6 o'clock Central Time, and I'll be able to take you along on Zoom by seeing you directly, and then adjusting everything directly to your need. You know, there are people who come in with individual problems like a shoulder surgery, or they have this acidity, or they have this recovering from a heart attack, or they are pregnant, pre-pregnant, and post-pregnant. We do uh, adjustable routines that people can do. So you got the idea. According to your requirement, we can do things for you on the Zoom, and where I can see you and you can see me too, and the other students also. But then, if you want individual sessions, I can always adjust them according to your individual problem. Okay. So the morning routine is designed after seeing what they are not doing at home before they begin the work, and how they are stressing out or burning out at work. People react too quickly emotionally, right? And that is something kind of curtailed by deep breathing. You know, people continuously talk to themselves and not focus on what they are doing, or they are doing multitasking and not having the attention span expanded because of that. So I kind of teach them how to be in the present, to focus in the morning. So when you go there, you won't react, but you will focus whatever goal you are doing, whatever work you are doing in flow. Okay. So imagine that, not having a chat in our mind, not having so much stress from the reactions, but then really focused on what you want to do, and you will produce a quality work, and that will feed your confidence too, and also maybe give you a raise because you are doing the job so well in flow. And you do work in flow, you don't feel the energy expenditure, and you feel very good, and you can do more work that way. Okay. By being attentive to whatever is happening here and now, usually I don't spend much time on other things. So at the end of the day, even though I did a lot of work with several patients, I still have a lot of energy left because I didn't waste it in unnecessary thinking, right? And also, whatever I do goes in flow, right? And I don't react that easily to anything that's happening. Somebody may make a comment, or somebody may look at the body language that is kind of uh, it can be hurtful if you allow it, right? But I kind of watch my thoughts and let it go frequently. Okay. So this is the room I come once in a while to really talk about my services, and also welcome people to ask me questions, anything that they have. Um, anything, okay. And most of the time people don't come up, but that's okay. Yeah, I will say what I have to say. Hopefully that will help somebody. you know Other service I'm providing and people can make use of is uh, when I come on the rooms, I may come with a specific topic, like I'm doing what are the myriads of advantages by being in the present. So I did first one, I did be present and be joyful. The second one I did was be present and be peaceful. you know so why are you not in the present? What does it mean to be in the present? That means you are completely in life. You are giving all your energy to what is in front of you here and now. Don't get used to the mental talk, chatter, and continuous planning. You know, that's what you want to get away from. Then, if you know your purpose, if you know you are doing it without expecting anything, and you're just doing it because it is duty for the sake of duty, right? And then you will be out of the ego frame, you will be out of this profit orientation frame, and you will be really focused on the excellence of whatever you are doing. So if you do something excellent, obviously results have to follow, right? So all you have to do is, what is that I am doing that is has a standard of excellence? Let me measure up to that, not according to somebody's comparison or somebody's say so, but because you know intrinsically what is excellence in that activity. If you can focus like that, you will be in flow with whatever you are doing, and you will not be spending a lot of energy by having all these unnecessary thoughts around. So I am not much for the multitasking of the modern age. I am for one single activity at a time. So my mantra, I think you must have known by now, is pay attention to every action. So in the clinic, for example, a nurse is receiving a patient and taking to the exam room, taking the vitals, medications, histories, and all that, right? So I focus on her every activity when I train them. I train them, go and call by the name of the patient. And when you see the patient, make eye contact, give a smile, and also help him to come to the room if he is not able to walk, maybe wheelchair, or if he's able to walk, you can hang on to him and direct him to the room where he has to go and explain every action that you're doing. I'm going to take your weight, I'm going to take your blood pressure, I'm going to make you sit down and give you a history of the medications we're going to check, and any changes from the last visit, or any allergies, any other problems like that, right? And then we incorporate all this into meaningful use of the medical care, and accordingly, people are responding very well, right? But then what the nurse did, each action, like receiving the patient, taking the patient, making him sit down in the exam room, explaining every action that she is going to do, that really casually done, but then we may break up into small talk, and usually the patients love to do that. When you do that, they'll become more comfortable. And when I come into the room, they already have all the basic data, and I let to speak for himself what's going on. This is the motivational interviewing, where we allow the patient to tell in his own language what's going on, what is his experience like, and then I'll be silent till he is done telling me. Maybe I'll have some few pointed questions, but after that, then I'll have to do my professional thing of examining and ordering tests and documenting and all that. While I'm doing it also, I let my patient get involved in the process. Otherwise, I am documenting by myself and he's left alone. So what I did was I put the computer screen that shows only his data towards his size, and then whatever I document, he will see what is going on with his values. Is pictorially if the cholesterol has improved or if the cholesterol has gone, like that. And then he is involved. He is not left alone as I'm doing things, right? And so after that, I also tell him what he could expect, what has happened so far, and how when he will be communicated with the pending results or whatever, and how we can sit together and then plan for his treatment and all that. Every step of the way, one thing at a time, the patient knows and patient participates and patient really takes interest in what is going on. Then he won't feel like he's left alone and I'm just documenting by myself. Okay, patient physician interaction is very important. If you bring in the computer in between, then you lose the patient. So I always, you will be surprised, I don't take a computer with me into the room. Even if the computer is there, I don't use it first. First, I will interact with the patient and let him tell me what he wants to tell and chat with me. And then I will ask pointed professional questions to get the information that I need. Then I explain that to him. So it's all interaction between the physician and patient at a human level. I never lost that art of medicine because I love it, and also I feel, what would I do if I'm in the patient spot and the other physician just documenting his way, never letting me know what's going on, right? So I have really talked extensively on this patient physician interaction and the computer in between. But I'm a big advocate for the EMRs. I promote them like anything. But that can be done when the patient interaction is. A lot of people say, we don't have that much time, that much of it. No, it's a question of interest. If you want to establish a rapport with the patient, if you want to really be listening to his experience of the illness, if you want to involve him in the care of his entire thing, then you got to involve him at the human level. Okay, so that's something I would advocate for any healthcare worker dealing with patient care, right? You can promote. I was listening to a talk this morning about exercise physiology, science about it and all that, and those kind of things are also promoted in our clinic, where when we diagnose initially the cancer patient, we refer them to the oncologist, and oncologist will determine what kind of care he has to have and all that. But we never let them go just like that. We will follow the cancer care along with him and also provide a uh, parallel support system, like how does he feel, how is his family is reacting, what are the stresses he is going through because of the new diagnosis, what are the problems he is developing because of the chemotherapy, radiation, whatever, right? That kind of really helped him to deal with the whole episode of cancer, or the side effects of the medications or treatments that he go through, right? So that kind of thing also plays a lot, even if the other patients. Holistic healthcare, attending to the body, mind, heart, this spirit, everything. That's my style. That's what I like the most about giving complete care. This came out of from the yogic point of view of our personality is built in 5 layers: the physical body, and energy layer of breathing and all that, and mental layer of thoughts and feelings and all that, and also our understanding layer, how much we understand the entire life and our relation to it. And then finally, how do you feel about things? Are you generally happy, joyful, or you're sad and depressed and all that? 5 layers. And you got to attend all the 5 layers when you deal with a human being. There are some people are stuck in some places and then you kind of release them. Emotionally stuck, intellectually stuck, or they may be not having understanding of the real truth, but they have sold some things and they kind of stick to them, and that's it. See, many people think thought is the highest thing, but there is so much more beyond thought. So that's why you got to silence the thought and then go beyond it. You can't even comprehend when you're stuck in the thought circle like intellectuals do. They read something and they heard something, and then they don't explore by themselves, and they may look at it superficially or a little deeper, but they're stuck. They cannot operate in silence. They cannot operate where your mind is still and your mind takes leaps into yourself much more deeply. Okay, so that's all I wanted to say for today. And if anybody wants to come up, and I will stay longer. Otherwise, it kind of you know don't want to go on saying the same things again and again. Okay. But in service, basically, I'm here to serve anybody if they want any answer, any question, or I may not have all the answers, but we can explore together and also see how you deal with this kind of thing. Have you ever encountered a physician that you felt like he should have spent more time with me, he should have listened to me, he should have really paid attention to my problems much more? And lots of times they may go home with more questions than answers. So what I did for my patients, I encouraged them to put all the questions as they come up, on a paper and put it aside and bring you the paper with them when they come to my visit. Many of the elderly people, they don't have any other social activity except the physician visit. So they may come with a lot of anticipation. They may not remember everything that was happening with them. And then later on, when they go home, they suddenly remember that. To encourage them to get all the data, I was telling them just document everywhere, or send us a fax, or nowadays just a DM in that portal. So that has become much more easier now. But then encouraging them and then following, answering them is the key. They may send you questions. If they want to answer them in the right time, they will be. So a nurse is looking up every day as a part of the business. How many people kind of ask questions, what are the questions, and then bring them to the notice of the physician. And then after his answers are given, take those answers and put it in the portal so that the patient has a response at least within 24 hours. If it is emergency, they call you anyway. If it is like something they could really ask on the online and you can respond. That's much better. Okay. I was on several, you know, travels going around the country about the HIMSS meetings, about the informatics meetings, about the medical conferences like that, right? Even when I was there, I got a lot of messages from my patient from different states. Some people went to Florida and they asked questions from there, you know. But then once you establish that kind of responsiveness, they will be very happy that you are able to help them in the time of the need. You know, if it is something emergency we cannot do on the phone, right away I direct them to the ER. You know, call the 911. Otherwise, if there's something they could resolve by themselves, a phone call. And then if you cannot do that, maybe they can come to the clinic and see us too. So that went very well. I was answering phone when I was in the airport waiting for planes, or I was answering phone when I was traveling by car in the rest areas. So I remember so many places, but it was enjoyable though. I'm doing a service for my patient, so I never regret it. That's the problem. If you resent, if you regret, if you really curse it, then you are going to lose a lot of energy through negativity and all. Wipe it off from your mind. Remember why you are here as a physician or whatever role you play. Then if you offer that service and giving itself gives you a lot of energy, right? So you don't have to waste through all that. Then do you have time for yourself? Plenty. I have a lot of time for myself because I kind of approach this other thing as a service, and that is done. Then I go and spend my time with my family and whatever. Even every day that is happening. I'm coming on talking to so many rooms. Rest of the time I'm with my wife and my children, and then I spend time with them, plenty of them. So they always know that I will give the same kind of consideration to my patients too. See? That's why I don't have this Friday complex. Like, I don't thank God it's a Friday. That is a uniquely American thing I see. So people don't have balance of the work and life. And why? That's my question. Many of my physician friends approach me and say, "What do I do to balance my work life?" I say, enjoy your work, enjoy your family, and always attend to them appropriately in the present time. You know, and also don't anticipate some vacation time that I'm going to relax. Relax while you are at work, relax while you are to the family. And lots of people don't know how to do that. They kind of fret the work and then they don't have any enjoyment from them because they are in a hurry to go home or to go to a vacation spot. Then only it's not that. It's how you handle your mind. If your mind is silent in the middle of the activity, you don't have any, thank God it's a Friday complex. Okay, you will enjoy whatever you are doing, and then you go home and then you enjoy your time with the family too. They will appreciate that too. Because you are not carrying work home, right? Everybody says don't carry work home, but then they don't know how to do that, right? So few more minutes I'll be here, and I have a meeting at 1 o'clock. It's like a 15 minutes to that. Anybody wants to come up, please come up and ask me anything in this time. Yoga is not just a physical exercise. Yoga is about understanding our five layers as I discovered, and then unifying them, harmonizing them. Don't put work against your family or family against your work. Approach equally both the work and the family time, and then you don't have this problem of work-life balance thing. The other thing was the resolutions you make, and then you never get to that because you are only making intellectual decisions that your body and mind may not listen to them because they have developed on their own way, the habits. And if you are only a thinker and don't know what is beyond thinking, you will never understand that. Okay? But if you know thoughts are happening to you, and thoughts are objects too, then they don't have the hold on you as much as you give otherwise. So learn to manage your mind and keep it rested when it is not needed. So that's very valuable. What do I say? Move your body and keep your mind silent. You may be moving your body. Are you keeping the mind silent at any time or only when you sleep? Sometimes people don't have the quietness in the sleep also. They dream a lot. You can try for that if you are having a lot of dream. Check yourself during the day when you are doing stuff. Are you completely attentive? That means, are you paying complete attention to anything that you do? Not only when you're crisis, not only when you're doing something profitable, not only when you think this has to be done now, because there's the danger if I don't do it. Leaving all that, can you be attentive to everything you do? You could be helping somebody in the morning, or you could be doing some paperwork in the afternoon, or you could be really spending some social time with your friends in a bar in the evening. Are you completely attentive to all those activities equally? If you can do it and if you can end that each activity, then brain doesn't have to work hard to put yourself in order. It, when you're sleeping, that is what the dreaming is about. Mind is still active, still trying to put everything in order. But it will go out of whack after a while because you never develop the inner resiliency to keep the mind silent. So my style is observe the thoughts as objects, use them as the situation demands, and end it. End the thought. As I do that, each patient comes in, I will use the data, I will use the history, I will use the information about him, about his condition. And then after I'm done with all the decisions, everything is there, they will be followed up later. But for now, why do I have to carry that to the next patient? So I empty it. And it's not that problem if you do it on a daily basis. And then when the 18 or 20 patients are done, I don't have any brain fog because I end everything as it develops. Hopefully that makes sense to you, and you can do that even if you are retired and old. Don't engage yourself watching a lot of TV or unnecessary gossip and all that. Instead, work inward. What's happening inside my mind? What's happening in my emotions? What's happening with my observe them as a third person as you experience them through the day and see the magic after that. You are separate from what is happening in the thought world or emotional world, and you are not dragged by it with the negativity or positivity and lose all your energy. And also, when you sleep, half the time is done by working on the mind and putting everything in order. You have only half the time really working on your organs to revitalize them. After all, that is the purpose of sleep, to revitalize your organs, including the brain. People don't know about that. So they will be thinking, 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 and then they will sleep on that thinking, and they wake up and they again get on the engine. So it's kind of running, running, running all the way. That's not good. When it gets to you, it gets to you in your old age. Many of the old people, if you observe, of course, for us, it's a professional thing. I'm a geriatrically trained person too. So when they come in the evening of their life, they always recollecting something that happened long time ago. But for their life, they cannot recollect what happened today or yesterday. So they struggle a lot. And then they don't want those, bad memories or good memories from the past come to them all the time. It is so tiring for them. They tell me that. But general tendency is give them medications and calm it down. But that may be immediate, but the underlying problem is not corrected. So I correct that by teaching them how to keep the mind silent by using some ancient techniques of meditation or some other ways. There are so many ways of meditation, right? One of the ways is repeating a chant. It could be anything, religious or non-religious, but the same thing is done again and again. That kind of calms your mind a little bit, you know. So that's very important for them. My own sister, she's 82. She cannot get rid of her memories because she has built up the highways for that. Okay. So when you want to sleep really good, when the sleep is going to work towards your benefit, not only the brain but also the liver, kidneys, and all that, they will be revitalized by the enormous relaxation that you could enjoy. You know, so I sleep very good. 2 hours, 3 hours. I sleep. I'm completely revitalized and get up and then in full energy. So it's a question of having the somebody coming. Let's see, Janet is coming up. Good, somebody's coming up. Hi, Janet.
I'm sorry, I hit the button by accident, Dr. Rao.
Yeah. Are you doing okay?
I am. I'm doing okay. I'm actually sitting in my diabetes doctor office, getting ready to go in and talk to him about some things.
Okay. Okay. Yeah.
So I'm expecting some changes.
Okay. Yeah. Yeah, do that. And if you can help you anyway, you can always DM me. Okay.
I will do that. Thank you.
Okay. Are you able to do the morning routine? Are you able to see it and do it now?
No, I need to get back with you on how to find you on other medias because I
Okay.
haven't had any.
Let me send you the Instagram link where you can see me and do along with me. Okay.
Okay, awesome.
I'll paste it here in your profile. Okay.
Okay, thank you.
Okay.
Have a good day.
Okay. Bye bye. Good luck. Okay. So, yeah, sleep is so important, and how the information is robbing it is something you want to pay attention to. Don't get into everything, and also keeping it with you. If you are unconscious about what's going on, how you are handling that information, and not able to empty it out as it happened, like I do, so much of information with each patient, right? But if I carry all that, then it will be like, so you have to learn how to empty your mind as you go along during the day, not violently, not forcibly, but very simple thing. You are attending to this patient completely. And the same thing the other next patient deserves. So you want to be intellectually available by not putting all the junk in your mind. So actually, that's what we do. We kind of put a lot of matter that's not related to our daily life into our dustbin of brain. We really treat our mind as the dustbin and gather lots of things, never knowing how to empty it. And the intellectuals are the ones who really proliferate this problem for themselves, for other people too. Use your intellect. Don't be a slave to it. Then you will have. See, this is where yoga starts when the thought stops. Yoga, chitta, vritti, nirodha. That means the vrittis, the thoughts that emanate from our past or from our senses or from our experiences, all that they come up on their own because we never allowed them to go away completely. So what they teach is, okay, you are not just your thought and intellect, and they're all your faculties. You could use them, but don't let them dominate. That's the problem. Once we dominate that, then you will stop there and you will go on unconsciously thinking all the things that you were never able to. That's why you have to identify who you really are and end up in that life force, and then thoughts stop by themselves. Once you touch that eternity, then thoughts will stop by themselves. So to understand that, you got to understand what is real yoga. Real yoga is not just a physical thing can be done for the health of the body. Real yoga is really going beyond the thought, emotional mind into our intuitively felt inner life force. Once you end up in that, okay, so as you still the mind, you really see tada drashtu swarupe avasthanam. That means your real self, that is swarupa. That is the one which reveals itself, and you end up in that, and you will be always focused, always in the present, always dealing with what is going on with enjoyment, with peace and joy. And that's why they always say, first be in yoga, then do everything. Yogastaha kuru karmani. That's how they describe. First be in yoga of really finding yourself and being there, and then use the intellect, emotional self, your all the thoughtful self, and also your body. So it's very difficult to really understand all that unless you touch your inner self by yourself. Don't read about it. It's not a theory. Don't take direction from somebody. No, you got to turn your mind inward and then observe everything without judgment and stay there all the time and operate from that reality. Okay, I do. That's why I don't get tired out. I don't spend energy unnecessary thought, and enjoy that quietness all the time. So I always told people, be in awareness, which is thoughtless state, and then use thought consciously to do our stuff, and then dump it. Come back to your original self. That is the trick. Once you understand and do it, you will have more peace and quietness, and also you will not be taking so vehemently seriously about the things that happen in your life, right? So you can be equanimous to the wins and the losses, and then enjoy both as they're happening and do what the best you can do. Okay, it's about 1 o'clock now. I will take leave, and because I have another meeting coming up, and I will see you whenever I can. Thank you for coming up. And if you have any questions, anything that you want to ask me, please DM me. Thank you.